Fortunately, the likelihood of having a major complication after most standard spine procedures is very low. Those complications, for the most part, are just going to involve the area that you're operating on. So if you're talking about operating in the low back, it's going to be an injury to the nerves themselves, the nerves that you're operating on, damaging them, which could leave somebody with worse pain, with weakness, with permanent numbness and tingling. A spinal fluid leak, when we go in and we do these surgeries, we are actually not seeing the nerves themselves. We're seeing the sac that surrounds the nerves and protects them. So that sac keeps the nerves and the spinal fluid that bathes the whole nervous system inside. That, in some cases, can be a very, very thin layer of tissue. And depending on what somebody has, how much compression they have, how much stenosis they have, there is always going to be a risk that we injure that sac and the fluid can come leaking out. In general, that's not a major issue because we can sew that up. But in certain situations, we can't do that, and that can predispose somebody to all sorts of complications ranging from meningitis to headaches to wound breakdown. So that's a CSF leak. That's always a dreaded complication of any spinal surgery. Fortunately, that does not happen very frequently, but that's something that we always talk to people about. Anytime we operate on the lumbar spine and we're going in and removing things to make somebody better, there's always a chance of destabilizing somebody's spine, taking away so much tissue that the bones can't hold themselves together anymore, spinal instability. So there would be a rare case where we go in and we do one operation that would lead to another operation, a spinal fusion, because we destabilize somebody. That would be very rare. And then the general risks of any surgery. Bleeding that would require us to go back in there and remove a blood clot. Infection, dreaded complication in anybody's mind. All these things are generally very rare. And then with a cervical spine, it's really going to be the same set of complications, but just pertaining more to that area. If we come through the front and we go through the neck, there's a theoretical risk that we could damage all those important structures in your neck, from your breathing tube to your swallowing tube to your arteries, your veins, the nerves that go to your voice box, and then the spinal cord. That's why surgery on the cervical spine is really a higher level of intensity than anywhere else, because you're operating on the spinal cord, and obviously you can't touch that, you can't damage that. That would be a devastating complication if you ever damage somebody's spinal cord. And it's in good hands. That really should never happen.